Morning, everyone. My name is Mongro from BA 5th semester, and I will be the host for today's webinar. First of all, before we start the program, on behalf of all the St. John family, I welcome our two most important guests for today's webinar. Firstly, I would like to have a brief introduction about our two guests that are here today. Firstly, respected Miss Imtikala, who will be sharing us on the physical well-being during COVID-19 pandemic. She has completed her bachelor's in biomedical science and then in nutrition and dietetics, as well as she has also done her master's in nutrition from London School of Medical Medical School of Medicines, and she did her internship for 4 months in Max Hospital, Gurgaon. And secondly, respected Miss Imlibenla Mongro, who will be speaking on mental well-being during COVID-19 pandemic. She's a clinical psychologist in CIHSR, Christian Institute of Health Science and Research. The area of work which is in charge in the CIHSR is psychotherapy for mental health and psychiatric disorders. She is also the award holder of Young Achievers Award for Mental Health in the female category for excellence in healthcare during the third National Health Conclave. Well, that was a short introduction for our two guests for today's webinar. And before we start our program, let us all seek God's blessing, and I give time to Miss Helium for the invocation.
Okay, then let's pray. Our Father, who are in heaven, we thank you for this wonderful time that you have given to each and every one of us. Although we are in different places, you have blessed us to conduct this program even in online mode. In this very hour, whatever we are going to do, Lord, be with us and guide us. Before starting our program, we need your blessings, help, and strength, God. I pray in Jesus' name. Amen.
Amen. Thank you, Helium. And now followed by introductory speech by our principal, Professor S.T. Janetius.
Good afternoon, everyone. First of all, let me thank the Students' Wellbeing and Peer Counseling Committee for organizing this program for the students. The topic is very apt because it is needed that we have to discuss about physical and mental well-being during COVID-19 pandemic. I'm little bit worried in the sense I don't want to talk too much, because if I talk too much, probably I will be touching the field of the main speakers. So let them speak. But I want to say only one thing, that I don't know whether we can differentiate physical and mental well-being, which is from my point of view, both are interrelated. For example, as a psychologist, if I look at mental well-being of people during pandemic, I cannot pinpoint any mental well-being or mental issues or mental health issues related to COVID-19 pandemic coming out of physical area. For example, I have seen a lot of studies. I have read a lot of studies, and I myself have done a lot of researches on this pandemic and related issues. One thing I have identified is, even though many journal articles and many writings categorically say, oh, these are the problems, stressors, then depression or PSD or whatever, stress or anxiety. So these are the things normally people talk. But from my point of view, when we talk about anxiety or stress or depression or whatever maybe, or that are related to mental disorder, mental well-being, that is coming individually from the person's physical well-being. For example, if I say I have stress or a student says he or she has stress because of COVID-19 pandemic, probably the word stress is same, but the reason for stress and the level of stress or the understanding of stress is entirely different between me and a student, because we both are in two levels of life. A student means probably the stress he or she is experiencing is related to that way of life, or maybe regarding studies or future concerns. For me, when I say stress, probably a lot of other things are there. A lot of other things are there. Now, therefore, I say every mental well-being issue is related to physical issue. Without touching the physical issue, we cannot even talk anything about mental well-being at all. We cannot talk at all. We cannot talk. Impossible to talk. Now, again, if you say physical problems, then it differs from person to person. Many people lost their jobs. Many people lost their income, business loss, or in general terms, we can say sudden change of economical insecurity. Probably that is the reason why many people are having stress. Many people are having depression. Many people are having anxiety, or whatever maybe. Whatever maybe whatever we talk about mental well-being. So both are actually interrelated. Unless we touch the physical issue of a particular person, particular individual, we cannot even talk about mental well-being. Categorically saying that everyone has stress, everyone has depression, everyone has anxiety is really meaningless as far as psychology is concerned. We have to identify each person. The problem is different. For example, if I am economically well off, probably my other part is stress or depression may be very less actually, comparatively. But if I have my own plans economically and which is also already disturbed, probably my stress will be very high, because my physical, economical program or plan is already disturbed. So it is completely interrelated, and without touching the physical, we cannot touch the mental well-being. That is the introductory thing I would like to say. And therefore, when we talk well-being, probably physical and mental well-being, unless we touch the individual physical problem or concern, we cannot talk about mental well-being. So both are interrelated. So probably we have to look that way. And with that introductory remark, let me give it to the specialized person. There's a clinical psychologist there. Madam, welcome for our college and meeting our students. And also Inti is also there, who has studied public health, and she'll be a better person to talk about the global issues. And I don't know what exactly she has planned for this day, but she will have a better input for you. And as a clinical psychologist also will talk from a deeper mental point of view. Probably. So I welcome both of you, and also I conclude my talk with a small concern that each and every one of you, we are all affected, and please listen carefully and understand the program, and let us cooperate ourselves and take care of ourselves from the talks that we have, so that we can safeguard ourselves, and also we can work for the well-being of the society. So thank you very much. Thank you for the Students' Wellbeing and Peer Counseling Committee once again for inviting me, as well as organizing this program for the students. Thank you very much.
Thank you so much, sir, for the introductory speech you've given to us. Now followed by Ms. Imtikala Au.
Hi, can you all hear me? Is it fine?
Yes, Miss.
Okay, so hi everyone. Thank you so much for the St. John College to invite me to talk about this important topic. And I also thank God that all of us are safe and sound, and we have this opportunity to, come to this webinar. So basically, we're talking about COVID. This pandemic has really made all of us stop and reevaluate our own physical health, and not only our physical health, but our mental health and our overall well-being. And it just made us see how crucial it is for us to stop and check in with ourselves, our body, and how we are doing as humans, you know. The basic point for this, for the COVID during this time, is maintaining a consistency for sleep. You know, we have to have 6 to 8 hours of sleep. Nutrition is very important, and also physical fitness. So I'll be talking a little bit about physical fitness and nutrition. So recently, like 2 days back, I was reading a study in the B.M.Sc Public Health. There was a research that went on, and the paper was out, I think, the beginning of this month. So the paper talked about physical fitness and how like COVID-19 and the pandemic has caused all of us to be quite physically inactive, and it has encouraged us to lead a very sedentary lifestyle. So sedentary means inactive. So, you know, basically all of us are doing work from home or study from home, and we're kind of like sitting in a spot for at least about 5 hours, you know, and we forget that we're not active at all. So the study kind of like suggested how this led to a lot of like physical fitness issues for ourselves, and also our mental well-being, which Ms. Imlibenla will talk about more. I'll just be touching a little bit because, as the principal said, both of them are really correlated to each other. So, you know, physical fitness is really important. The WHO really recommends for an adult, like all of us, to have at least a maximum of an hour of physical fitness, not even an hour, but about 30 minutes to an hour of physical fitness, which is very important for us, not only for our physical health, but also for our mental well-being. So especially for students here, a little bit of exercise, a little bit of jogging, a little bit of walking here and there could really help you reduce your stress hormones that we have in our body, which is the adrenaline and the cortisol. So it really reduces that when you exercise, and also it really helps you, it really helps stimulate other hormones that are like, you know, mood elevators, like endorphins, or like natural, they're also called natural painkillers. So these are like very important things for physical fitness. And also when you're physically active, they really help you reduce various diseases like, you know, type 2 diabetes, various cardiovascular diseases. It helps you really maintain your weight, and, you know, it keeps you also like mentally sound. So yeah, physical fitness is very important during this time, especially during a pandemic, when you're in a lockdown, and, you know, there's a lot of anxiety going on where you feel like, you know, you cannot go out or you cannot take a walk because you're worried that you might get, you know, COVID or something like that. But I feel like if you follow the right guidelines, you know, wearing double mask, sanitizing yourself, you know, following a proper nutrition, following the social distancing rules, I think physical fitness can be done even at home. You know, small videos of like dance videos or cardio videos or whatever that's going on YouTube. Next, I wanted to talk about was so a little bit about the myth that is going on about the vaccine, COVID vaccine. So I was working for 4 months in Max Hospital, and we had a lot of people, and I was part of the vaccination drive with me and another doctor and 2 other nurses. So I was leading the vaccination drive for it, and you come across a lot of people with a lot of misconceptions about the vaccine. And, you know, it's normal to have a lot of misconception about something that's new. You know, I would just like to talk a little bit about a few of the important misconceptions that came up. So there has been a lot of rumors about the vaccination being the vaccination affecting women's fertility. The fact is, it does not affect women's fertility. It is quite safe, because the truth is the COVID-19 vaccine, it encourages your body to create a type of spike protein. that is the same spike protein that is in the coronavirus, so that it kind of teaches the body and the body's immune system to fight the virus. So the whole rumor and the whole false report came about in social media when people started forwarding messages that were false, like, you know, the spike protein that is in the vaccine is the same spike protein in our body that's called syncytin-1, which I think most of the science students know that syncytin-1 is helpful for your growth and attachment of placenta during pregnancy. So those were the false rumors that came about. So it kind of like made a lot of women anxious to take the vaccine. But the truth is that both the spike proteins are different to each other. They're not at all related, and so the whole rumor was false. Because during the COVID trials, there were about 23 women volunteers that were in the COVID trials, and not that all of them wanted to get pregnant, but the ones that wanted to get pregnant did take the vaccine and got pregnant. So the whole thing was false, and this is why it is very safe for women to take the vaccine. The next thing that came about was if you're, you know, some people came about to the hospital saying that, you know, if you're fully vaccinated, then you will never get the COVID and you will never be positive for the COVID, which is also false, because yes, you get the vaccine and you are safe from most of the infections, but it doesn't mean that if you are fully vaccinated that you will not get the COVID. You will get the COVID, or you may get the COVID, but the complications will not be that much as for a person who is not vaccinated. So I was reading a paper on the Center for Control, Disease and Prevention, and it was written there that adults who are fully vaccinated are about 95% at lower risk of hospitalization than people who are not vaccinated at all. So that makes you think that, you know, yes, like vaccination is important because it will prevent you from like further complications, and it will not take you all the way to hospital, and it will not, like, you know, lead you to some serious illness or serious complications. And yeah, if you see the Delta variant right now, you can kind of see that even in the UK, you can see that a lot of adults that are, like, you know, positive with corona, they are fully vaccinated, but the hospitalization rate for that is very low, which is why vaccination is very important. This is what I wanted to come to. Also, the next thing that was, there was another misconception that I really wanted to talk about was a lot of people saying that, you know, if you're going to take multivitamins or like minerals and supplements, you know, these help, like, you know, these help with like curing the disease, but but that is so not true, because multivitamins and supplements that we're eating and which are good for your health, but they only aid your immune system. They don't really cure the disease. But a lot of people have a misconception of that it cures the disease. It does not. It just aids with your immune system. So, you know, overall, like during the COVID times, you really want your immune system to be at its optimum rate so that it can function well, your body can function well, your body can fight the disease. So, which is why all these things are needed. I just wanted to talk a little bit about that. And I wanted to talk a bit about nutrition. Yeah. So nutrition is very important during this COVID times, during the pandemic times. Just having a balanced diet, which means eating food from every group of your, you know, the food pyramid, the food groups like vegetables, meat, poultry, dairy, good fats like nuts, and, you know, just unsaturated ones. Also including a lot of vegetables, which is very important for our nutrition and for our overall immune system. You know, a lot of papers in the journals, a lot of research papers have suggested that vitamin C is very important for us. the normal daily intake for vitamin C for male is about 90 mg per day, and for female is 75 mg. And you get those vitamin tablets. So this is very important because there have been studies which have shown that vitamin C has really boosted your immune system and really helped you fight the virus. So this is very important. I feel like nutrition and physical fitness is very important. Being really active, not really active, but being a bit active is important. 30 to 1 hour of active level is really important. And also mental health, which Ms. Imlibenla will talk more about. So yeah, so this is all I wanted to say. I hope all of you have learned something. And if you want to read more on this, I have a lot of papers that I have, and I could give the links to Ms. Sumita, and you could ask her to read these papers, or you could ask her for these links if you want to know more about it. If not, you could email me. I will give my email to Ms. Sumita, and you can ask me more questions if not. Thank you.
Okay, thank you so much, Miss Imtikala. I hope my fellow mates and my juniors and my dear Jonas will focus more on their physical fitness after after such a wonderful explanation about nutrition and physical fitness. Like even me, I feel like going for jogging now after hearing these things. I hope there will be a question and answering round as well. That will be taken up by Miss Roslyn, Assistant Professor of Education. So after everything is done, you can ask questions, do our two case. So now we will go with the next thing, followed by Miss Imlibenla Mongro, who will be speaking on mental well-being during COVID-19 pandemic.
Hello, can you hear me?
Yes.
Okay, I just got a call right now, so the connection went off. I think you
Uh,
were giving me the time, right?
yes. Now you can. It's your time to share us.
Okay.
Share.
So your Madam Sumita was saying that I have around 30 minutes. So I will try to, help you guys understand a little bit about mental well-being in that span of a time. Uh, Thank you for having me here, and the introduction by our respected principal. It really makes sense, and it feels as if like I'm just going to be adding on that and what our dietitian expert has talked about. It's all connected. So now, when it comes to mental well-being of COVID during this COVID pandemic. What I was thinking about to tell you, my dear fellow, Nagas, our students, our teachers, what I wanted to talk to you most about was I was thinking the things that will be relevant to us the most is what I'm going to talk about. That is by concentrating on the experiences from my own patients and the people that have come so far after the pandemic has started, or because of the pandemic, some of the problems that my patients have brought in. I wanted to club them together and talk about it so that we will be able to relate more and we'll be able to understand what's happening to our society, to our people, to all of us. There are so many literature and theories that we can look into, but because of the lack of time, I will leave that to you all. Okay, so just after this is over, you can just go back and read up, compare it to the latest trends, the latest studies that have come out. So I will talk about what I have experienced as a clinician so far after the pandemic has started. Okay. So many people they do not come saying they have mental health problems. They will come with different kinds of problems, and when we explore it, yes, it points to mental health issues, but there are so many other factors that have come up during this pandemic that are affecting people's physical health as well as mental health. And there's just so much to tell you guys, but I just wanted to concentrate on one or two factors that we can all keep in mind and we can all do. And I'm pretty sure that we all are facing this as a problem. And I'm going to talk to you about sleep disturbances and mood disturbances, okay, and distortion in a sense of time. And why I have taken these three is because they are connected to one another. It's like one causes the other, and the other causes the other, and then the other causes the first one. You know, it's like a cycle that we need to put a stop somewhere. So, why I brought out sleep, and then I was so excited when our dietitian expert started talking about sleep, but I thought she'll go more into it, but she didn't, so I will just, do that as a continuation. Uh, Now, there is something called delayed sleep phase syndrome, where many of the patients that have come to me, especially young people, they've said that their sleep routine has changed drastically. They're going to sleep very late, they're waking up very late, and that's not the problem at all for them. The problem is now they are unable to go back to the way they were before. Now they were unable to go back to normal sleep routine. Even though they're trying their best to sleep on time and wake up on time for their online classes or even for their regular classes, they are unable to do that, and it's causing a lot of problems. Now, why I'm talking so much about sleep is because when it comes to mental health, some of the biological functions that that gets affected is our sleep, our appetite, our mood. These are all linked together. So this is and one of the major thing that we need to fix immediately is our sleep schedule. This is what I want to majorly emphasize on, because as students, I know that we have a lot of assignments to complete, a lot of project works, a lot of studies to be done, and we have a certain sleep time. But during this pandemic, what has happened is that because of this extended holiday, I should say, or because of this very long vacation, even longer than summer breaks or winter breaks or any breaks that we have ever seen in our student life, this really extended vacation, it has become sort of like a habit for us, nah? And then like even parents also, they are like, okay, let the children sleep for however long they want, they will get more peace. So even parents are allowing children to do that. Even young people, like, oh, I don't have to go to class tomorrow. Oh, we don't have to go anywhere tomorrow. So I'll sleep as late as I want and I'll wake up as late as I want. So now the difficult part is that they're unable to concentrate. They have a lot of mood swings, mood disturbances. So now, why is sleep very important? Is because, see, when you have any disturbed night, say maybe you didn't sleep well last night, so today you know how your mental state is going to be. You're going to be a little moody. If it was one of the teachers, you're going to be more irritable with your students than your usual self. We're not going to be able to focus or concentrate, and our mood is going to be so fluctuating. But what happens is we're able to bounce right back, because it's like one-time thing, or it does happen sometimes, when we have a lot of episodes to watch, and when we have a lot of reading to do. Sometimes that happens, but we are able to bounce back because that is not our routine. Now, during the pandemic, this has become a routine. A disturbed sleep schedule has become a routine, and studies have shown that prolonged, disturbances in sleep is linked to a lot of mood disturbances. Okay, so you can read up on that, but you can actually see it from examples like, you try to wake up a sleeping infant, okay, try to wake up a sleeping baby and see if the baby will wake up smiling or cranky and crying. Okay, so from the infancy stage, we can notice how sleep and mood is so much linked with each other. Now, so even for adults, it affects us in a lot of ways that we do not realize. So mental health studies, so many papers have shown that prolonged exposure or prolonged sleep disturbances, it's difficult to get back to normal mood state. Okay, so if you are facing some mood fluctuations, really moody, more anxious than usual, or more low than usual, just try to look at your sleep pattern once and try to see if you need help. And it feels as if like I'm a harbinger of bad news, but correcting delayed sleep, correcting sleep disturbances is not that easy, and you will need professional help. You will need a lot of behavioral changes. You will need, very small baby steps to get back to normalcy. And most people, they have tried, those who go to sleep at 2 a.m. or 3 a.m. in the morning, they're trying to sleep at 9, 10 suddenly, and it doesn't work, and they get frustrated, and they start feeling like, oh, I can't even do this correctly. They start blaming themselves, they start labeling themselves as, they have all these self-defeating thoughts, and that leads to more anxiety, that leads to more you know sense of depression and all those. Okay, so that is why I know when my patients come and they talk about all the stress factors they have, say the family dynamics is not okay, their study related stress factors, relationship problems, whatever, they talk to me about it, and yes, we try to do something about all those. But my primary concern is, have they fixed their sleep schedule or not? Have they gotten back their sleep schedule the way it was before? That is what I try my best to do first, because like our principal said, we cannot isolate physical, the manifestations and behavior from mental health manifestations. We cannot isolate these two. One causes the other causes the other, so which is why this is one thing. There are so many things that's affecting the mental well-being of people during COVID, but one major thing is the disruption of sleep. This is what I want to really stress upon, how it is linked to mood disturbances, and how mood disturbances, if the mood disturbances go on for a long time, you will start developing anxiety, depression, and other emotional problems. So how that is linked, one is linked to the other. Now we don't realize it, or we may not have realized it before the pandemic, but most people, our normal lives are very structured, very, very structured, and we're not aware of that. Okay, and because of this structure, we have certain social cues that tell us what to do, when to do, how to do, so now this is again, it will come back to sleep. These social cues, it guides us throughout the day to do things, to be organized, to complete our tasks, to finish our day, So during this pandemic, this structure seems to have, gone away from most of our lives, especially the structure of a school, for children, the structure of going to classes every day, the structure of going to work, See, at the end of the day, when you're sitting in the classroom, even without looking at the watch, you start feeling slightly restless, you start planning mentally what to do after you go home, you start planning to wrap up your things and just go home. Nobody has to tell you that, hey, it's time to go home. Hey, the day is ending and we have to go home. Nobody has to tell you, but the social cues that we get from these structures that we live every day, this is the one, driving our biological clock. We have a biological rhythm in us, and when that is disrupted, that will affect our sleep, and that will affect the mood. So we're coming back to sleep again. So I just want to talk a little bit about this structure, how it is very important to get back a sense of structure in our lives, even when the pandemic is going on, even when we have to stay at home, even when there is a lockdown. it's very important to get back a sense of structure. Another example could be you start getting hungry at the same time every day, right? That is because we have our meals same time each day as much as possible. We have certain cues, we start smelling food from the kitchen, or somehow our body just comes to know, and then our body just starts signaling us with the hunger signals. Nobody tells you, hey, it's time to get hungry, but our body, our brain naturally understands, because of, again, structure in our lives, because of the social cues that we have. And during this pandemic, we are lacking in the social cues and the structure, and it's nobody's fault actually. Our duty right now to maintain balance and well-being is to try to bring about our own structure and to bring about our own social cues, even in the midst of all these challenges, the SOPs that we have to follow, physical distancing, not, visiting one another, not, I don't know, if our schools and colleges are closed. In spite of all this, it's our duty to try to bring back a sense of structure in our lives, which will help us somehow, which will help our brain not get so confused, our biological rhythm going smoothly. Okay. So when I'm talking about structure, I'm talking about routine. Now, when I was having a webinar for childline people and parents of small children regarding having a routine for the kids, I realized that the same thing won't work on us as adults. Okay, children, they need a routine for, every day, like a fixed thing. Parents should, have a routine for them, a time to study, a time to eat, a time to sleep, a time to wake up, a time to play, a time to watch TV, a time to be on their phones, or play mobile games, or whatever it is. Children need a little more rigid structure than we do. Now, it doesn't work well for adults because of the various things that we have to do throughout the day, So what I usually tell young adults like you guys and other adults like us is that even if you try to bring a structure into your life, try your best not to make it too rigid, as in please don't plan for the week, don't plan for the months ahead, don't plan for the year ahead. I say, I'm gonna give out a very cliche phrase over here, but the phrase "one day at a time" really rings true. Okay, I always tell my patients, please plan your day one day at a time. You go back to sleep, and before you go back to sleep, you just plan about tomorrow only. Do not plan for the next day. Do not plan about. You can think about the future, but it's best to plan and have a structure for the next day. Like tomorrow I'll wake up and I'll do this, I'll do that. I have to go there, I have to talk to this person, just about tomorrow. Just try to finish doing tomorrow, because when you extensively plan and have a very rigid structure system for your entire life, and if suppose one day for any special reasons you were not able to do that, then frustration is going to set in, disappointment is going to set in, and many people, they like to say, oh no, I can't do it, see, this is not in me, this is not my cup of tea, and then they just give up, and again they go back to having a structureless life. So in order not to do that, I always try to help my plan, set goals to have a little bit of structure just for the next day, and then have variety for the other day, according to what is your type of work or according to what you have to do. So don't stress about what you're going to do next month or the coming years, but I feel like we should worry about tomorrow, just one day at a time. And another important thing for us to maintain our mental well-being during this pandemic is to stay connected with people. I know we have to keep our physical distance. We must not visit our elderly family members or even visit one another during this difficult time. But as the society keeps changing and we come up with with new ways to cope up, there are new ways to keep in touch. And even for children, I ask the parents to help them to be in touch with their friends, with their classmates, with their cousins through video calling, or chatting or over the phone. So it's important to keep in touch, important to have a time of the day where you connect with people, a time of the day where you do your work. So when you're structuring your day, make sure that you don't do one thing throughout the day. Like you're not on PUBG throughout the day, you're not on ML throughout the day, or you are not binge watching on shows throughout the day. So don't say like tomorrow I'm going to watch the whole day. Nothing like that. I'm just saying when you try to put a little bit of structure, just limit your plans to your sleep time, wake up time, your meals, and your work time. And then after that, you connect with people whenever you want. You play on your mobile whenever you want. You play or you watch your K dramas or whatever it is that you watch. But make sure that the other that I mentioned just now, sleep, wake up, meals, work. Those are some things that you need to actually fix in order to get a sense of time. There has been a study. Are several studies that talks about how people have lost a sense of time in this pandemic. Either it's going too fast, it's going too slowly, and it all points to having less of a structure in their life as compared to the way they were before the pandemic. And that has caused a lot of disruption in sleep, a lot of disruption in so many other activities. So yeah, during the Q&A also we can talk about all this, but because of the lack of time, I just wanted to concentrate on this very important aspect. And if there are more things to discuss, you can always contact me. I will give out my contact details to your ma'am. And you can, if you live nearby, you can always come by the clinic, the hospital. We can have a chat about all this. If you're having concentration problems, if you're having memory problems, if you're finding it difficult to get back to your sleep routine, if you're more moody than usual, see. Yeah. So structure. What did I say? Connecting with people, and very important. Lastly, the one of the most important things that I would like to emphasize on is to acknowledge whatever you feel. Okay, do not try to dismiss your feelings away. Do not try to keep it aside, saying, no, I'm too busy for this. I should not think about this. I should not feel anxious. I should not feel depressed. I should not feel angry. Now, that is not the way to go about. You should actually let yourself feel whatever you feel. Okay, psychology says that, we have an unconscious sort of a container where we repress our negative feelings, the things that we don't want to think about. But as is with all containers, these tend to get full. And when it is full and we don't let it out in a healthy way, it tends to, say, burst out in the form of, anxiety attacks, panic attacks, or even nightmares, bad dreams, again, sleep disturbances. You will know by today's talk that I value sleep a lot. So should you, okay? Sleep is very important for our mental well-being and physical well-being. So I hope you all have a very good night's sleep tonight, and I'll see you in the Q&A round if you have any more questions for me. All the best, and don't hesitate to contact me for any questions. Thank you. I think you are muted.
Manuel, please unmute yourself.
Hello, can you hear me now? Hello.
Yes, we can hear you.
So sorry, I was facing some network problems. That's why. I hope everyone has learned the importance of sleep, and I'm sure many of you will be sacrificing your K-dramas, Mobile Legends, PUBGs by the day itself, just to have a good sleep and have a good mental health. Thank you so much, Miss, for sharing us the importance of sleep and the importance of having some routines. We have, I believe that our Saint John family have learned good things today. And now we move on to the next thing. That will be taken up by Sir Peter, administrative head of our college.
Hello. Can you hear me?
Yes, sir.
As if to prove a point, my daughter has just woken up and decided that she is not happy because she has not slept well. So hopefully she'll not disturb us too much. Thank you, Imti and Imlibenla for, is that correct? Yes. Yes, sorry. For the words of wisdom that have preceded me, and also Principal Janetius as well. I don't want to speak for very long. I think I'm listed as just talking about COVID around the campus and this kind of idea. So I think there's not a huge amount for me to say that's not already been said. And that I think most of you are already well aware. You know, we are, I suppose, 16 months, 18 months into this pandemic situation, and we are all now very familiar with the concepts of social distancing, with the concepts of you know, good sanitization, good personal health and hygiene. These concepts are all important. I don't know if you have seen something referred to as the Swiss cheese model that goes around. If you're familiar with Swiss cheese, that is the type of cheese that is full of holes. So they talk about this Swiss cheese model in terms of different layers. So your mask is one layer of cheese, your vaccination is another layer of cheese, your hand washing is another layer of cheese. And when you stack up all these individual things that have holes, eventually you come up to making a barrier that is relatively secure. So you think about every single aspect you know, that has been spoken about, the hand washing, the vaccinations, and all these things as being, nothing is a perfect solution, but in combination, all of these things provide you a good level of protection that you can then start to go about conducting your life in a way that is, you can go out and exercise, and you can go out and meet your friends and enjoy all these experiences that are so important, both physically and mentally, in a way that is safe, and you can do that with confidence. So you know, I thank Imti for spending the time. She drew attention to a few different aspects of what to say. You can talk about fake news or these conspiracy theories going around. You know, we are blessed in some ways that this pandemic has come at the time it did. I hate to think how it would have affected us 10 or even 20 years ago, you know, before the era of Google Meet, how we would have managed to conduct classes without the technology. You know, the technology is flawed, but it has allowed us to do something, and it has allowed us to stay in touch and to communicate in a way that wouldn't have been possible before. So that's a positive aspect of technology, but the negative aspect is that we're able to share misinformation as easily as we do good information. And it's very easy to believe things that we receive from our friends psychologically, again, I'm sure Principal Janetius and will tell you that we are attuned to believe things that we see from our friends. So when we see certain things going around on social media, if it's coming from a trusted friend, we are much more likely to believe that, whether it is true or not. So we have to be very cautious that we take responsibility personally to fact check things that we read, and then also to be careful what we share. If you're going to fire on a circular message, just take a minute and question where it's come from, what the purpose of that message is, what is being said, and whether or not it is true. And this applies to so many things, not just the COVID pandemic. I also thank ma'am for drawing so much attention to sleep. Again, I think this is not necessarily a new thing. I think people in the college stage of life, I can remember my own personal experience of my college days. Maintaining sleep patterns during our college days is not always easy. And there are so many things that we like to do in the evening. And as young people, our circadian rhythms are maybe a little different. But maintaining good patterns of sleep is such an important thing. As she says, one night's bad sleep can really affect our mental performance and our mental health. So I trust that you've all taken notes there. And then, speaking specifically about our time on campus, as a management and as an institution, we have tried to make as many arrangements as possible to ensure that adequate space is given in classrooms, so that we can socially distance, so that you can make sure your hands are sanitized, and we're encouraging you all to wear masks. So do be conscious of these things on campus, and when you see a friend who's you've not seen in a while, try and refrain from getting too close. I think one of the things that has been difficult with this COVID pandemic, particularly I would suggest for your generation, is the fact that COVID has mostly affected the elderly and those that are weak. And for the most part, I'm pleased to say that most of you are both young and healthy. And maybe the sense of risk you will not feel. And it's quite possible, more than likely, that if you were to contract the virus, you may not even know that you have it, that you may carry it asymptomatically. And because of these facts, I think that there is a sense among young people that the vaccine is not necessary, and that some of the precautions that we are taking are too much, and that your freedoms are being impacted too much. And I kind of understand these points, but I think we have to think a little bit beyond ourselves, and we have to understand that every time you come to the college or every time you go home, you will be interacting with people who are older or are having health issues that maybe you don't know. We all know that diabetes and hypertension, things like that, are significant precursors to COVID. And we know that both of those issues are quite common in the local society. We don't know what health conditions some people have, and maybe there's reasons that they are unable to take the vaccine themselves, and for them they are relying on the rest of us to be careful that we don't carry the virus around. Imtikala mentioned that the virus or the vaccine reduces the risk of serious complications by 95%. If I'm not mistaken, the vaccine reduces the risk of you contracting the virus in the first place around 50%. So, the vaccine is not a magic bullet, and it does not mean that you will never pick up the virus. But as Imtikala alluded to, I don't know if any of you are football fans. I'm, for my sins, an Arsenal supporter, and I've had a pretty sad week in the wake of the opening season of the Premier League. But watching football from last weekend from the English Premier League was such a good experience. I watched a few games that beyond the Arsenal, and seeing full stadiums, seeing thousands of people come together, and even on a television, the atmosphere and the enjoyment that transmits is really a great thing to see. And I really long for the days that we can come back to having social events on campus, so we can have our cultural days and this and that. But the point is that the UK has been able to get to that position because they have a very high vaccination rate in the UK. And the cases, or the new case rate, has not dropped off massively. They still have significant numbers of new cases, but they have very dramatically cut the number of hospitalizations. So people are still picking up the virus, it's still circulating, it's circulating less, but the people who are catching it, if they are vaccinated, they are much, much safer than they were before. So, these are all reasons why, even as young people, we should be seriously considering taking the vaccine. And maybe this is a good moment to say thank you to all the staff of the college. One of the reasons that we have been able to open the institution when others are not yet open is because our staff, 100% of our staff, have gone ahead and taken the vaccine, which was optional, and we have laid out the reasons that we think it's a good idea. But ultimately, that was a decision that's been taken by our staff, and I was delighted that every single one has gone ahead and done that. And to my knowledge, there's nobody that's reported any significant side effects. I think a few of us, or a few people, were a bit feverish the next day. I personally felt like I'd been thumped in the arm for a few days, but beyond that, I was okay. So, by and large, the vaccine is safe. It seems to be effective at preventing the spread, and it's allowing life to slowly move back to a normal, or a situation where we're able to enjoy each other's company and conduct events in a large scale that we would like to do. So, these are, I think, all the things that I want to mention. Just like I say, on campus, continue to be cautious, to continue to take precautions, but do come and do see your friends, do meet your staff, because as alluded to through the talk, being stuck in your room, the lack of routine, the lack of variation in life, so many things that Ma'am mentioned, I felt like I could tick off my own personal checklist of, sleep patterns being disturbed, the sense of time being disturbed. I think we're all experiencing these factors. So being able to come back to the college campus and see our friends, even if we're not allowed to give them a big hug, is still a positive thing. So thank you for the time, and I will end there. Pass back over to Mongro.
Thank you so much, sir. I hope good days will come soon, and like previous years, we'll have programs in our college, a lot of co-curricular activities in our college as well. Now, it's the moment all the students have been waiting for, the question and answer session. Now, I hand over this session to Miss Roslyn Chang, Assistant Professor of Education Department.
Thank you, Chairperson, for the time. Am I audible?
Yes, Miss.
Okay. Now we shall have the Q&A section. So firstly, a request to all the participants to kindly mention the name of the resource person to whom you are addressing the question, so that it gets clear for the resource person to answer it accordingly. All right.
And you can either unmute yourself and ask or drop the questions in the comment section. I hope you are all clear with that. So participants, you can take your time. If you have any queries or doubts, you can ask now. Yes, participants. Does anybody have any questions to ask?
What did Imti say?
Yes, anyone?
Yes, Imlibenla, right?
Imlibenla, not Imti.
Yeah, I said Imlibenla.
You did, yeah.
So like a moment apparently.
Okay, we have a question from Anjali Kumari. So Anjali Kumari, you are addressing this question to which resource person?
The mental department, mental health department.
Okay, I think it's Miss Imlibenla. Question is for Miss Imlibenla.
Okay, what is the question?
Yeah, it's how do we deal with our mood swings? That is from Anjali Kumari.
Great question that warrants a whole hour to talk about, but I'll just tell a little bit, how to deal with mood symptoms. See, the first thing is to try to identify why are you having your mood symptoms, okay, or your mood swings, okay. Is there a particular reason for it, or you just feel like I don't have any particular reason, but I just have this, I don't feel so good these days, okay. So it can be like that. You can either have a specific reason, or you may feel like you do not have a specific reason. The first thing is, I think you have already acknowledged it, but for everybody here, in order to deal with your mood symptoms, if others have pointed it out, saying you seem more moody than usual, or if it's you yourself who have sort of become aware of your mood symptoms, the first step is to identify, to acknowledge that you have it, and then to try to find out why. Okay, so like I said in my earlier talk, if you are noticing a lot of changes in your biological rhythms, in your sleep patterns, in everything, that if you feel like your daily life is disrupted, then that could be one major reason why you have your mood swings, and you need to correct that particular why in order to deal with your mood swings. And if it's something else, like a stress factor, say your studies, or you're not able to do something as well as you want to, or it's some relationship problems, family problems, whatever your cause is, it's good to try to understand what is causing your mood, your mood swings. And if your mood swings is constant, continuous, or if your mood swings is like mostly during your class, or during the evening, or when you're with your family, it's very, very important to understand your environmental triggers, whatever is triggering you. That's the first thing in order to deal with your mood swings. The next thing is, once you identify what is causing these mood swings, uh, there is something that you need to think about. That is this factor, the factor that is causing my mood swings, is this something that is something that I can actually do something about? Is it something in my capacity? Is it something that I can deal with it, or is it something that is beyond my control? You need to try to ascertain that first. Okay, is it something that you can fix, or is it something that's not in your control? Is it something that is, that you have to do it immediately, or is it something that, we say things like, oh, only God knows, or oh, it's only the universe knows, or it's beyond me to do anything about it. So whatever your stress factor is, if there's something that you can do about it, then you should not wait. You should immediately go try to fix that, try to solve it, whatever the stress factor is. If there's something that you need to talk to, if the stress is coming from some because of lack of communication, then you need to go and talk about it. If it's to do with your studies, you need to go and try to get help, try to finish it. If it's your assignment or some deadline that's coming up, anything that you feel like you can do something about it, I actually can do something about this. If you feel like that, then you have to do. While on the other hand, there is something called, there is a type of stress factors where it's giving you stress, all right. It will give you stress, and the problem may still be there, but there are some things that you absolutely have no control over. It absolutely can do nothing about it. We have problems like that, right, at times. Say for example, the pandemic, if you are worried about your family getting the virus, or yourself, or how it's going to be, and you're thinking about it, and this is causing you mood swings. But apart from the COVID appropriate behaviors, there's nothing you can do for the pandemic to go away. Or say your friend doesn't want to talk to you anymore, and you have done everything that you can to try to mend the relationship, and it's not happening, then the decision on that person's part is beyond your control, right? So when any stress factor that you have identified, which is causing you stress and mood swings, if you know that it's beyond your control, then what you have to do is you have to focus on your emotions. We call it emotion focused problems. So if your problem is an emotion focused type, try to identify what this stress factor is causing you emotionally. What kind of mood swings are you having? Like, is it swinging between anger and sadness, or is it irritability and anxiety? What is it? You try to focus on that and try to do things that will reduce those negative emotions. Try to do things that will reduce that, but only use this technique only when you absolutely are sure that there is nothing you can do about it. Say for example, you have a deadline to finish and you're really agitated, but instead of working on your assignment and trying to meet the deadline, instead of doing that, you're just focusing on your emotions, and you're like, oh, I think I will do this and I'll feel better. No, you have to actually finish it if it's something that you can do. But if it's something that's beyond your control, then it's no use obsessing over it, overthinking it. It's no use trying to solve it and beating your head over it. So in short, I think I've ranted a lot, but in short, try to identify where your mood swings is coming from, the first thing, and try to ascertain whether it's something you can do about it or it's beyond your control. And if it's something you can do about it, do not wait, get to it immediately. And if it's something that you feel like is beyond your control, then instead of focusing on that stress factors, you focus on yourself, on your negative emotions, or whatever emotional problem it's causing you, and do everything within your power to feel better about that situation. Maybe the problem may not go away, but at least your mood swings will reduce. I don't know, that was really short. I take a lot of sessions for this, but that's all I can say in this short span of time. Sorry, and thanks.
Okay, Anjali Kumari, I hope you are satisfied with the answer. Okay, any more questions from the participants?
Hello, ma'am.
Okay. Yeah, you may ask.
Okay. My question is, Ma'am Imlibenla.
Okay, go ahead.
Ma'am, ever since this pandemic has started, the mental health, the word mental health has almost become like a hype in the society. So like it's not like before this pre-pandemic situation, it was not much of a, it was a thing, but it was
Mm.
like that is you know. So like just wanted to know how it has been, how our like how our so, previously what we experienced is like when we talk about mental health, we don't have much kind of that discussion. But when we talk about mental health, it's kind of like a very specific kind of discussion. So like how our psyche is responding and like as a the events, so like how do you deal with this?
Mr. Viloto, I'm very sorry, but your voice kept cracking and I couldn't catch much of it. I think it's because of my network. If somebody else has got that question, can you please summarize it to me or, repeat the question or send it in the form of a message? I'm so sorry, but your voice kept cracking and I couldn't catch your question, Mr. Viloto.
Hello, ma'am. Can you hear me now? Am I audible now?
Yeah, I can hear you now.
Okay, so I just want to repeat my question. Like, this mental health topic is like a very high topic of discussion. Like the pandemic has seeded as a society for discussions. Just an subject of mind that before this pre-pandemic, we discussed like as three of as a discussion today. Like whenever we talk about physical health, there's not much of a negative stigma that comes along with it. But when we talk about this mental health, there's a lot of negative stigma that comes along with it. So like I just wanted to know, as a society, specifically in Nagaland, how is our approach toward this topic of discussion and like and how are we dealing with it? And like as a students, as a literate students, and how can we deal with this negative stigmatization regarding about this mental health topic of discussion?
Okay, I got it. I mean, again, initial part of your question was not clear, but towards the end, I could catch whatever you said. So I'll just to be clear, you're asking before this pandemic, mental health talk, even though mental health conditions existed way before, we weren't talking much about it. But after the pandemic, like everybody's talking about it, and then along with that, you are saying that there is a lot of stigma and discrimination attached to mental health problems and how to deal with that. Am I correct
Yes,
with the
ma'am. Yes,
question?
ma'am. Yes,
Okay.
ma'am.
Yes. See, when it comes to stigmatizing people with mental health conditions, no, it's not just people stigmatizing other people. Okay, there's something called self-stigmatization also that we need to know, where you think negatively about yourself if you suspect that you have mental health conditions. Now, that is also there that we need to talk about. This usually happens to people who are a little, say, I don't want to, without revealing anybody's names or demographic details. I have seen this in people who work in the ministry, people who work in areas where they everybody think that they should not have mental health problems. That will include us as well. That will include medical professionals or people who are providing services. So. Uh, when it comes to doing away with stigma regarding mental health, one of the sure means, that everybody can do, the society at large, or even the student body, the community, everybody can do is talk more about it. It should become so common, like, we say chini bimar, no, for diabetes, or pressure for hypertension, we just say pressure problem. So as common as people don't stigmatize people who have cancer or high blood pressure, hypertension or diabetes, because everybody is talking about it. It's so common that we have normalized it in our conversation. So I know that this is being repeated again and again, but a lot of awareness program is needed. For students level, I would suggest the authorities of your institution to think about starting peer group counseling. Many institutions have started this, where the students, are trained or taught to identify mental health problems in themselves and in their friends. Because in one of my studies, some of the young people that I've talked to, when I ask them, like, when they have a problem, when they're stressed out, who do they think about first? Who do they think about going to first? Many of them have said, definitely not adults, definitely not professionals. I think about my friend, I think about my best friend, I think about, my sibling or my cousin. Most of them, they say they really do not want to go to adults, because adults always dismiss our problems. And they always keep comparing their lives to our lives. They say how easy it's for us and how difficult it was for them. So there's a lot of communication gap between young people and adults. So in order to make it more, and then some of them, they've even said that I even feel hesitant to talk to my friends, because I feel like they will start a rumor about me, they will spread, they will gossip about me if I tell them that I have this problem. On the other hand, that is also what's going on. But many studies have shown that peer group counseling has really worked in normalizing mental health conditions and mental health stigma and discrimination among young people, when they can find somebody to talk to. Not saying that they will become therapists, but just identifying and being a shoulder to lean on, a shoulder to cry on, being a good listener, and guiding them to get the right help. It's very difficult for people to come to a therapist's office or a hospital as soon as they think that they have mental health conditions. First, they try to Google it, they try to talk to their friends, they try to talk to people, and after a lot of thinking, a lot of encouragement only, they muster up the courage to go and seek professional help. Even thinking about seeking professional help has a lot of stigma attached around it. So I always, when I go to the community, I always tell them about training them as gatekeepers, bridge as a bridge, or we use the term hand holding, psychological first aid. So students, no matter what age you are, with what age group you are in right now, I think it's very important to talk about mental health as a subject, as a topic of conversation, discussion. Normalize it as much as possible in order to reduce the stigma. We can't just say, go away stigma, we have to do something about it. And one of the easiest way to do it is just to talk about it as normally as we can. Will that do, Piloto?
Thank you so much, ma'am, for really giving us an insight about it. Thank you.
Okay, all right.
Okay, is there any more questions from the participants? Okay, we got another question from Hela.
Ma'am Rosalind?
Yes,
Just
sir.
before we move on to the next question, since Ma'am Imlibenla mentioned the helpfulness of peer counselling, anyone who's wanting to become involved in the peer counselling group, you can contact Ma'am Sumita or Professor Janetius, and I'm sure they will be happy to have more people involved in the peer counselling teams in the college. That's something that the principal has been keen to get started and work on over the last few years. So that's all.
Yes, yes, absolutely. Everyone is welcome to join.
Okay, let us continue. Here is a question from Helam. What are nutritional problems and how do they affect us? I think this question is to Miss Imtikala. What are nutritional problems and how do they affect us?
Hi, can everyone hear me?
Yes, yes, I can hear you.
Okay, so Miss Helam, right? You mean nutritional problems during the pandemic or just in general nutritional problems? Are you wanting to know? Hello? Hello? General? Okay. So there are various nutritional problems that we have, especially for a developing country like India. So we have the nutritional problems I would be talking about is like example, anemia, being anemic, maternal nutrition anemia, or even like malnutrition, in India. The most common one is the double burden of malnutrition, which is when a group of population is also overweight and obese, and they are also malnourished. So these are all the nutritional problems that we have. Like I said, how do they affect you? So as somebody had a question about mood swings, right? Up in the beginning. Hello?
Yes, yes.
Yeah. So somebody had a thing about mood swings too, and Miss Imlibenla really explained it really well about pinpointing the cause. But also that could also be related to your nutritional problems. So like nutritional problems like overeating, undereating, all of these are related to mood swings. A lot of these are related to mood swings, like when you have a blood sugar fluctuation or you have nutritional imbalances in your body. This all alter your mood swings. So if I have to pinpoint one that something that would affect you guys, especially for college students, like when things are too when life is too busy or you have way too many lectures, you start skipping meals. So this also affects your mood swings because it kind of like affects your low blood sugar in your body. So you feel weak and tired, and so all these things are interrelated. Do you want? So yeah, if you want to know more, do you want to know anything more specific?
Why don't you mention something? You just mentioned about the double effect of both being overweight, but at the same time malnourished. What does that mean exactly?
So it's basically this double burden of malnutrition. It's usually seen in developed countries, so countries like India, countries like China. So this is when a population is half of them are undernutrition, are undernourished. There's thinning, there's short stunting, which is like short. Your weight, your height is short for your age. And then there's the other part of the population which are overnourished, like there is overweight and obesity, and this you can see, and this is correlated to all this. Both the double burden of nutrition is related to non-communicable diseases. So these are like type 2 diabetes, heart diseases, various heart diseases, cardiovascular diseases, blood pressure that you see, high blood pressure. You see all of these a lot in Nagaland too. So these are all correlated because these are all non-communicable diseases. So these are all related to the double burden of malnutrition. Is that clear?
Okay, so Helen, I think you're satisfied with the answer. Any more questions from anyone? Okay, we have another question from Akivili Nchishe. The question is, how do I deal with someone telling me what to do regarding my mental health? I think that question is for Miss
Me.
Imlibenla. Yes.
Can you just tell me again? How do I deal
How
with
do I
others?
deal with someone telling me what to
Uh-huh.
do regarding my mental health?
I would like to understand this question better. Is this person mad at somebody else, for pointing out that she has a mental health problem? Like, is that it? And I want to understand the question first. It's in the message, right? So I'm just going to read once again.
Yes.
How do I deal with someone telling me what to do regarding my mental health? It sounds like Miss Akivili is not happy with someone telling her what to do regarding her mental health. Can you elaborate on that question a little bit more,
Uh,
sis?
Ma'am, no, ma'am, it's not like that. But if in case,
Uh-huh.
I have a mental health and someone advising me, some may be good or some may be bad, and so it's important to find out what works best for me. And so I just wanted
Okay. Okay. So, my dear Akivili, first of all, when someone tells you to take care of your mental health, it can be very confusing when somebody tells us that, right? It can be very confusing, like, especially if you were not aware. Okay, let me just try to break this down and try to answer you as best as I can. Sometimes when people tell us that it can be very confusing, especially it depends on who is telling us. Okay, if it's somebody that you don't like, then it could really upset you. And if it's sometimes when it comes from people that we have conflict with, that can give us a whole set of different emotions. Sometimes when it comes from our mentor, say, or somebody that we respect or look up to, or sometimes when it comes to, I mean, if it's somebody like, say, our best friend, so that could give us another type of emotions. So when somebody tells you like that, um, I'm pretty sure we will have mixed emotions, but we need to, first of all, keep calm, like the internet meme says. And then I think it's always good to take it positively. And then you think about why that person would say that, And um, I would just, I don't like advising and suggesting, but I would, in this exceptional case, I would say that, you should have to think about why somebody would suggest that, And in my earlier talk about identifying why you have mood swings, this also calls for some level of identification in your part, Why would anybody say that? Did they say that out of spite, or did they say that out of concern? And whatever it is, do I give out some vibes, from my maybe attitude or my behavior or the way I speak or the way I carry out myself? Do I give out some vibes that show others that I may be struggling with my mental health? And if I am struggling with my mental health, then I need to do something about it. So these are, see, when somebody says, oh, you have a fever, you need to get it checked. What do? Yes, you like, okay, let me get my paracetamol, let me go to the hospital, let me whip out my thermometer and see my temperature. When it comes to physical health, we are very quick to do something about it without even without even thinking twice. We don't even have to wait for people to tell us what to do. But when it comes to mental health, and I think Mr. Viloto's question will also come in play here, because of the stigma and discrimination that people face, that this is why Ms. Akivili is bringing out such an important question, how do I deal with someone telling me what to do regarding my mental health? I think this will touch a lot about stigma and discrimination, because when we even mention the word mental, people have a lot of warning signs going off in their head. And this is because we grew up hearing that mental means pakala, or mental means 75, mental means crack, crazy. So this is why I think my earlier answers on the stigma of mental health and trying to identify and be aware, self-aware of what's going on in yourself is important. Akivili, if you want to talk more about this, you can, always, ask me again, outside this webinar. I feel like, you need more than what I'm saying. But for now, I think I'll stop here. Is that okay?
Yes, ma'am.
It's more, yeah, it's more about why would anybody say that to you, and why do you think that they would say that? It's more about being aware and identifying if there's anything that gives off such vibe, and it's good to be aware of yourself, right? It's good to be aware of how others see you and whether you actually need to do something about your mental health. Higini. I don't know if I've answered it correctly, but you can always, contact me again for this, outside of this.
We have another question from Guneli Ai. The question is, how can I deal with overthinking and stay motivated at the same time?
Okay. First of all, we have a lot of negative connotations attached to the word overthinking. I always, when especially young clients, they ask me, I overthink so much, what do I do about it? I said, why should overthinking be a bad thing? Why should overthinking be why should it necessarily be a bad thing? So, and then they get taken aback, like, huh? And I'll be like, see, it's not overthinking, it's not the process of overthinking that is bad, but it's what you are overthinking about, and whether your overthinking is bringing about any productivity or not. See, when you are concentrating on your, so let's just get technical. When you're concentrating on your studies, you're studying for 1-2 hours, you are actually overthinking about that particular subject. Okay. When you are daydreaming, you're overthinking about something that you like. When you are, missing your, loved ones, you are overthinking about it. So the process of overthinking itself need not necessarily be bad. It's more about your overthinking. Is it causing you to show negative behavior or a positive behavior? Is it bringing productivity, or is it not bringing any productivity? So because when we attach a lot of negative connotation to the phrase overthinking, which is why we're like, oh, I shouldn't overthink, oh, you overthink too much. So it's more about seeing overthinking in a different light. Okay. And you can overthink and still be motivated, but it's more about what are you overthinking about, and is it bringing about any positive outcome, right? If you are planning to go on a holiday and you're thinking about what to carry, what to buy, what to go when you go there, you're still overthinking, but you don't stress out about it, because we attach a lot of negative thing to this word overthinking. That's why we overthink about overthinking, right? There's another thing called obsessing over something. Overthinking, you're just thinking about a lot of things, and obsessing means you repeatedly think about something over and over and again, and you cannot control that thought. Now that can be a little problematic. Okay, when you obsess over, that's called obsession. To come under OCD, obsessive compulsive disorder. And in order to call it an obsession, which I think you are confusing with overthinking, in order to call it an obsession, you would have to be obsessing over a single thought repetitively, even though you shouldn't be you shouldn't be obsessing over it. You know that it's irrational to think it over and over and over again. So that we may have a problem with, but you can still be overthinking about something positive. You can still be motivated. Just change your perspective a little bit about the phrase overthinking. Will that do for now?
I think that is a clear explanation for the question being asked. Another question again from L. Yongmai Pom. The question is, normally we feel moody when we wake up after a nap. Why is that so?
Okay, and by nap, I think you mean afternoon siesta. I know that in many cultures we take naps in the afternoon and or right after lunch. And sometimes we wake up feeling really energized, you know. Sometimes we wake up feeling even more moody and cranky, like you are describing just now. It can vary, okay. There can be so many reasons. But one thing I would like to say is that for sleep scientists and sleep research studies, they say that 1 hour of daytime sleeping really disrupts about approximately like 3 to 4 hours of your nighttime sleep, and daytime sleep will start from 6 a.m. in the morning. So say for example you're accustomed to having naps in the afternoon, then your body is already, adjusted to it. But say you're not accustomed to taking naps in the afternoon, and one day you just happen to take it, then really it could really wreck your mood that day. And also, one thing you need to think about is when you take a nap suddenly and it's not a habit of yours, you need to think about why you really need that nap. It could be because, coming back to my, topic of choice, it could be because you didn't sleep well the other night and you're trying to compensate for it in the afternoon, right? If that is the thing, then you're getting sleep, but you're not getting a proper sleep cycle. Your cycle is not complete. It's like breaks in that cycle, and that's still not going to improve your mood. So in order to understand sleep and the way it disrupts our mood, you need to look at your everyday schedule. You need to look at the level of adjustment your body has gotten to in regards to afternoon naps. And it's all about understanding your context. What has happened the previous night? What's going on? Are you still stressed out? Sometimes when we take naps in the afternoon, we wake up really tired because of sometimes we may have a lot of vivid dreams, lucid dreaming. So all of those things can really make us even worse, when we wake up. So there are a lot of things to there is not a single factor to pinpoint, but you need to try to understand what was going on when you were taking the nap, the previous night. How was your sleep like? Are you going through some stress when you're having that sleep, which made you even more moody, So, yeah. I'm just sorry that this type of talks, we need a lot of sessions, and I do hope that we can continue having sessions like this in the days to come. But uh, I don't know if that answer did it, but
Imlibenla, if
yeah.
you don't mind, can I just make a comment? And please correct me if I'm speaking ill or wrong here. I've seen quite a lot of research recently around sleep science, and we're talking about people doing studies on afternoon naps, and I've seen that in certain tech companies in Silicon Valley, like nap pods and sleep quarters are becoming a popular thing. They're like actively encouraging people to take a short nap in the afternoon.
Yeah.
And they're seeing positive impact on that. So from what I understand, I don't know the pattern that Youngmei is following, but you mentioned yourself like an hour of sleep in the day can be damaging. And from what I understand, and based on my own experience, if you're going to nap in the afternoon, it's better that it's short, like 15, 20 minutes. And there can be a positive impact from that kind of length. But then if you sleep beyond that, as you say, maybe it's related to just generally being fatigued, or you've not slept enough at night. If you sleep beyond that, you're then going into a different phase of sleep, and then disturbing yourself during that deeper phase of sleep. You tend to wake up groggy and grumpy. Whereas if you have this short power nap, as people refer to it, 15 to 20 minutes, I've heard some people even say, drink a cup of coffee and then go to bed, and you'll wake up feeling perky.
Yeah.
There's different things. So maybe just that length of sleep is affecting.
All right. So let me just clarify. When I was talking about a little longer sleep during the day, like the daytime sleeping, see, when we sleep, there is a certain cycle that gets completed. We have, if you read about REM and NREM sleep, I was talking about when you sleep at night and then your sleep extends till morning. So that's when the sleep cycle goes on until the daytime. I mean, it continues to daytime sleeping. That's when it gets wrecked the next night, the following night. But when you have completed a successful sleep cycle at night, and then you wake up as usual, and then for some reason you wanted to take a nap, then most probably that nap will not be as deep as when you sleep at night. Okay, so but then sometimes it just so happens that we sleep a little too much even during the day because I don't know, we're tired. So what happens is the body still does not know whether it's time for the actual sleep cycle to get completed, or it's a siesta, or it's just a nap that you're trying to take. The body is not able to distinguish between that, especially when you're really tired. So what happens is when you're trying to take a short power nap, sometimes it tends to go a little extra, and that's the time when the body thinks it has to complete a sleep cycle, a full sleep cycle. But since it's the afternoon and we cannot sleep for 6-7 hours, so the sleep cycle is not completed, and then you wake up in the middle of your sleep cycle. That's when you are all groggy and confused, and sometimes you're like, is it morning, is it evening, what time is it? So that's what happens. I don't know, Mr. Peter, is that a little clearer?
Yes, ma'am. Yes, ma'am.
Yeah, the study into sleep is very, very interesting, and I wish we had sleep clinics in our hospital. We have a lot of people who come with a lot of sleep problems, and the sleep hygiene that I initiate, actually we have to do it under observation, in sleep clinics with CCTV camera and all that, but we don't have that facility, and it's a really tedious process to understand sleep and try to correct it. But yeah, it is what it is. It's an interesting talk, though. We can plan it for another day and time.
Okay. I want to take this opportunity to ask a question to Miss Imlibenla. How can we prevent ourselves from insomnia? I know this is a very common question for everyone, but many times this is it's a major problem among many youngsters. And not just for the students, but as a teacher, I do face this problem at times. But sometimes nothing works out. So, ma'am,
nothing works. I know.
Yeah. So, do you have any better preventive measures or idea through which we can deal with this issue?
Yeah, when we do the sleep hygiene thing, the first thing we need to do is we need to do a lot of physical changes in our room. One is no television in the bedroom. Try your best not to do your paper checking or any other things in the bed. There is a hormone that gets released in our brain called melatonin, which comes out at night in the dark, and during the day it apparently stops coming out, so that's why we're awake. That hormone is responsible for inducing sleep. So what happens that causes a lot of insomnia in us is, even though we turn out the lights and sleep, we have a mobile to our faces, right?
Yes.
We have the mobile directed at our faces, and that is also a form of light. So some theories, they say that even that can cause the melatonin to stop producing, and that will stop the sleep from coming. That's one minor factor. Another thing is our lifestyle has changed so much that our bed has become a multi-purpose venue. Okay. Long time ago, our parents, our forefathers, their bed was for sleeping or for relaxing. They come back from the field and they have a specific bed and they don't even have a mattress. It's just a hard piece of wood where they lie down and they fall asleep. And it's their designated place to sleep. They don't sleep anywhere else. They will refuse to sleep on anybody else's bed. If you look at our culture, now our lifestyle has changed so much that the bed is like a multi-purpose arena where you eat on your bed, you sleep on your bed, you watch TV, you game on your bed, you chat with friends on your bed, you do so many things. Even I do my crochet, or other. We have breakfast in bed, which isn't not so good for keeping it as a lifestyle. So what happens to our brain is that the brain has a very interesting way of forming associations. So what I tell my patients who are having insomnia, or to even prevent insomnia, is that we need to try to form an association between the brain and our sleep in such a way that the moment you get up on your bed, you just feel sleepy. That relaxation comes over you. There are some people, we say, no, that the moment they smell the sweat from their pillow, they just drift off to sleep. We say funny things like that, but actually it's true. When we need to try to associate feelings of sleepiness with our bed. That's why the first thing I tell my patients is to do a lot of physical changes around their room, no studying on the bed if possible, in order to avoid insomnia. If you have been doing that before, then maybe you should try to change it. No studying on the bed, no watching movie on the bed, no doing anything. This is just to fix insomnia or to prevent insomnia, okay? Even though you have had this lifestyle for a long time, it could be the onset of insomnia. So a lot of things to do. So dark room as much as possible. I tell my patients that do all your gaming, all your movie watching, everything anywhere else but not the bed. Do it on the sofa or on the chair, on the floor. Sit and do wherever you want. But jump onto your bed only when you start your eyes close. You start feeling sleepy and your eyes start to close and you're dozing and you're like, absolutely, I'm about to go off into my dreamland. That's the time you come and lie down and try to sleep. Now when you keep doing that exercise, the brain forms an association thinking, okay, so this person, whenever he comes to bed, it's time for sleeping. So that association gets formed and strengthened. And so as you keep doing this, one day the moment you see your bed, you'll just feel relaxed, you'll just feel sleepy. But like I said, we do a lot of things on our bed, right? We are watching movie, we're browsing YouTube. So the brain is like, is it time to sleep or not? Am I supposed to be giving you concentration? Am I supposed to be keeping you alert? Are we supposed to sleep? What is it? We are confusing the brain a lot by this mixture of behavior that we do during our sleep time, no? So that is why a lot of behavioral changes are needed from our part, just for fixing the sleep. Also, a dinner we shouldn't go to bed as soon as we are done with our dinner. A lot of physical activities during the day and in the evening also really helps in order to prevent us from developing insomnia, especially caffeine, tea to be avoided. Our dietitian will be able to tell you properly, and especially if you have a very small bladder, like you feel like getting up to pee every now and then it's better to avoid water, when you're about to sleep. I'm not sure how that will work out, but many people, they keep getting up in the middle of the night to pee and then unable to go back to sleep. So like I said, some of the basic things to do is a lot of behavioral changes around your bedroom. Your bedroom should be like a sacred place just for sleeping, so it's very advisable that students have their study room elsewhere, not in the bedroom, if possible, if physically it's possible. And if it's not possible and you share a room with your siblings, or if it's not physically feasible, then at least have the study area outside of the bed.
Okay.
So
All
for
right.
families who have children who sleep with them and they watch TV before they go to bed, it's advisable that you move the TV to another room and have a specific time to watch the TV.
Okay.
Yeah.
All right. Thank you, ma'am. It was a much needed answer. I'll definitely try to put it into practice personally. Okay, thank you once again. Yeah. Let's take the last question. This question is for Miss Imtikala from Kumili IE. What are the benefits of drinking chlorophyll water for Miss Imtikala?
Yeah. Hi, I'm Fafa. So the chlorophyll topic is a really lengthy topic, but I'll try to summarize it as much as possible. I'll just try to introduce a little bit if nobody knows what chlorophyll water is. So it's like a new trend, that's been happening on TikTok and Instagram, where people are drinking this green color liquid in their water, and apparently it helps with your skin and weight loss. So chlorophyll is actually an antioxidant, right? And for antioxidant means how we have it in green tea and other fruits and vegetables. So these are actually, antioxidants are actually meant to help your immune system. It boosts your immune system. That means it makes your body work better, right? It helps with your health. It helps with your skin, with your hair, with everything. So chlorophyll is actually just, the green things that you find in plants. So that's chlorophyll, right? But when you buy a supplement, it will not be called chlorophyll, but it will actually be called some other name like chlorophyllin, because you cannot really put chlorophyll in the supplement, right? So there will be another version of it. So basically chlorophyll is very it contains a very high amount of copper and sodium, and these are all the minerals that we need in our body for it to function well, right? So there nowadays, there is all this trend, she asked right now, Kunili, right? She asked about chlorophyll water. There are a lot of pharmaceutical companies and different companies and supplement makers that are trying to sell this chlorophyll water for weight loss, and it does help because it is antioxidant. It's full of antioxidants, so it helps with your damaged skin, with your acne. But at the end of the day, you don't have to waste money on buying all this, because chlorophyll, you get it everywhere. All the vegetables that you're eating, everything green. Just imagine you're eating broccoli, you're eating mustard leaves, you're eating spinach. So all of these are greens, so you're getting chlorophyll. So these pharmaceutical companies and supplement makers, they're just trying to sell you a product that you're already eating, you're already getting in your garden. If you go outside your garden, if you have a garden, you see all these green plants. All of these contain chlorophyll. If you steam it, also for veg and vegetables, especially vegetables, you have to steam it only for 5 to 7 minutes, because if you steam it more, then all the nutrients evaporate. So you have to steam it only for that much. So what I'm trying to say is that this is just a trend. It's just almost like a fad diet, keto diet or no carb diet, something like that. But chlorophyll is easily available. You don't have to buy chlorophyll supplements. You don't have to buy those liquids, because if you just go to the market, supermarket or something, you can just buy a bunch of spinach and add it to your meals, put it in your smoothies. So but at the end, the conclusion is that it is good for your health, it is good for your skin, it is good for acne, it is good for just everything, because it has full of antioxidants. I hope I'm clear. Is that fine?
Thank you, Miss.
Yeah.
Okay, Kunili, I hope you are clear with the answer to your question. Thank you, Ma'am Imti. And also, thank you so much to all the resource persons for clearing all our doubts and queries. I'm sure it was worth for each participant attending this webinar. Thank you once again. Heading back to the chairperson, Mr. Montemo, you may take your time.
Thank you so much. I hope everyone has cleared all your doubts during the question and answer session. Now I give time to Miss Sumita for the word of thanks.
Okay, thank you, Montemo. I, on behalf of the SWPC Committee, Student Wellbeing and Peer Counseling Committee, would like to express my gratitude to the two resource persons. Ms. Imtikala, thank you for sharing your insights and telling us how to stay fit and physically fit and healthy during these trying times. And I would like to also express my gratitude to Ms. Imlibenla Mongro. The pandemic has not only threatened our physical health but also our mental health. So thank you for telling us in details how to stay mentally healthy during this time. I would also like to express my gratitude to the administration, so principal and our administrative head. Without your assistance and constant guidance, this webinar would not have been possible. And also, Sir Peter, thank you for taking out your time for sharing your insights about how we can come to campus classes and yet prevent contracting the disease. Thank you, sir. I'm blessed to be part of a committee where there is a competitive advantage compared to other committees of St. John College. I'm saying this because this committee comes with a capable team of peer counselors, and by default, they are very helpful people. So when I needed some kind of assistance to put together this webinar, I had never had faced any dearth of helping partners. So thank you, peer counselors, those who are working from the front and those who are working behind the scene. Thank you so much for all your help. Also, my two colleagues, Ms. Roslyn and Sir Thangboy, thank you for your assistances. And of course, my other colleagues who have joined and has become a part of this webinar. Thank you all. I think I might be forgetting to thank some people, so I apologize. But I just feel blessed to have all of you here. And lastly, I just want to thank the resource persons again because you have not only given the assistance during this time span, but also offered to give assistances beyond the time span of this webinar by offering to give your email IDs and phone numbers. So really thankful to both of you. And lastly, I would just like to say that the feedback link is there in the chat box. So participants, you can click and give your feedback and it will automatically lead to generation of an e-certificate. Thank you all. Have a very good evening.
Thank you, ma'am. That was an excellent event. Well done. Thank you, Imlibenla, Imtikala, both of you, for taking the time.
Okay, thank you. Thank you for having me. Bye. All the best.
Good evening, everyone.
Bye.
Bye.
Thank you, ma'am. Thank you, sir.
Good night, everyone.
Good
Good
night.
night. Good night, demo.